It is a nightmare, and very soon it is going to be the law of the land. Many of you were watching the healthcare vote last night. I'll tell you, I was glued to it. We got a texter here saying, I watched the vote last night and actually felt fear when it reached 216. I watched the vote. I felt sick when it reached 216. I mean, my stomach, it started churning where I thought, as the tally was going on and the numbers were rising, I said, no, there are going to be a few people who step out and vote the right way on this. There are going to be a few more Democrats, right? And no, in the end, there were not enough Democrats. Our number is 591-8900. Cisco Cotto here with you. We're going to talk with Congressman Don Manzullo here. He was obviously there last night and voted the right way on this. But we wanted to get some clarification on some things from him and also talk about the way forward. Is there any sort of a hope to at least curtail some of this stuff? Good morning, Congressman.
How are you this morning?
Well, I've had better mornings, to be honest with you. I really have. Are you stunned? Let me start with this. Are you stunned as you're on the floor and you're watching all this happen before your eyes and knowing that there's really nothing you can do about it?
Well, it's not a matter of being stunned. It's a matter of feeling the disappointment of so many of my constituents who are really desperately trying to get a health insurance but are barred by pre-existing illnesses. And this bill doesn't help them. It puts that change in insurance policies off for 4 years and then tries to create some kind of an interim fund, which the state of Illinois already has. So, you know, I know we're going to start getting calls at the office saying, where can I sign up for this and sign up for that? We're going to say, you know, most of the benefits are delayed for 4 years, but the taxes start right away.
So they just wanted to hurry up and get this passed so that they have something to not only start getting those taxes, but just something to run on. I mean, so they can say, hey, look, we allow you into insurance now, even with pre-existing conditions.
Well, they wanted anything, and the real problem on this is that 16 million more Americans are added to the rolls of Medicaid. This is what the Democrats say is going to cover them. Now, for the state of Illinois, that means about 330,000 people will be added to Medicaid because we're about 2.5% of the population. Cost on that somewhere $400-500 million a year, with a promise, quote unquote, of the federal government to pick up that additional expense. Well, you know, the federal government has promised that in the past with the Individuals with Disability Education Act, the IDEA Act, and said that here's a state mandate, but the federal government's going to pick up X amount, and it never has. So now you've got a Medicaid system which is so poor in reimbursements that the state of Washington is no longer honoring prescriptions for Medicaid patients. Think how scary that is. And a lot of doctors will not take Medicaid patients because the reimbursement is so low they can't even afford to open their doors to treat these people. So and now it's swelling by 16 million nationwide.
So we're saying, hey, congratulations, you get the opportunity to come into a health plan that most doctors are nowadays stopping seeing patients from.
Well, yeah, and you talk about shortage of physicians and waiting lines. I mean, that's not a solution to it, just slapping more people into Medicaid. And then you have a bill that's going to cost $565 billion. It's going to trim, quote unquote, $500 billion from from Medicare, and we're at a point now where under 1997 Balanced Budget Act, amounts were supposed to be cut back from the doctors on reimbursements to bring down the system. Those delays or those reimbursements have been delayed in a bipartisan manner. So doctors are now owed about $220 billion. I mean, how can you expand the system and at the same time cut back on the amount of reimbursement? You simply can't do that. But you know what really bothers me, Cisco, among other things in that bill? My wife came down with cancer 4 years ago. And thank God she's okay now. And it was a tumor that settled into her vertebrae and exploded the vertebrae. And the neurosurgeon had to go in there and pick pieces of that exploded bone away from her mylar sheath that wraps around her spinal column. And then he inserted a titanium brace. It's actually an artificial vertebrae. Under this bill, that device that keeps my wife from a wheelchair would be taxed. How is that going to bring down the cost of health care when the very life-saving devices that are on the market today, the CAT scans, the MRIs, the radiation machine that kill the cancer around that bone, they would all be subject to a 2.5% excise tax? I mean, how do you bring down the cost of health care by increasing the life-saving devices? You don't.
It almost seems, with Congressman Don Manzullo here on WLS, it almost seems as though the end game is one of a lowest common denominator. You know, all those people who get the really nice fancy treatments, well, let's go ahead and put them in a position where maybe those aren't offered anymore, and so you expand coverage where more and more people are treated, but they're actually all treated at a lower level.
Well, yes and no. You could have coverage but not get service. That's what you have in Canada and England with the long waiting lines.
Yeah, and then what good does the coverage do you?
It doesn't do any good. I mean, we've got, you know, as I said, people that have some real problems getting insurance because of pre-existing illnesses, and we want to help them. But this bill puts off any help to them for 4 years. When the Republicans, in our alternative plan, would really help those by allowing these mass purchasing pools, purchasing insurance across state lines, and would have actually saved about $65 billion over 5 years as opposed to costing $1 trillion or so.
Congressman Don Manzullo, explain for us this issue of unions and these Cadillac plans, because there's some information going back and forth and we want to try to grasp it. Are unions going to end up having to be in a position where their plans are going to be taxed? Is that what's going to be the result of this?
It's possible. What had happened was the bill that the Senate, that the House passed last night, does have the tax on the unions and everybody else. The so-called reconciliation bill also passed, raises the threshold on everybody's health insurance plan that could be taxed. I think, you know, and we're still going through the bill, I think your plan has to be have a value in excess of $28,000 a year in order to be taxed. But I also don't think that it's indexed for inflation. So that means, as with the alternative minimum tax, it's just a matter of time before that insurance policy gets taxed.
Yeah, at some point it'll catch up with you.
Well, it is, but the bigger problem is that with the overloading on the system, you're going to have a greater demand, you're going to have bigger waiting lines, and you're going to push us bigger into debt. But Cisco, you know, the big story is not health care. The big story today is that the bond market says it's safer to lend to Warren Buffett, Procter & Gamble, Johnson & Johnson, and Lowe's than it is to lend to the federal government.
Isn't it stunning? And stunning, and especially considering what happened yesterday.
That's right.
Continue to spend.
That's exceedingly rare event in history that would ever happen. And that means that there's an international loss of confidence in the dollar. And wow, when you have that taking place, and now all this additional spending. Whew.
Yeah, what are you going to do?
Kerry would have said, holy cow.
It's unsustainable. There's just absolutely no way that they're ever going to be able to pay that debt back, yet they keep on borrowing.
They keep on adding and adding to the debt. Now, with this bill that passed yesterday, the initial figures are bad enough, but they would be wonderful if they stuck. I went to school at American University in 1965, and I worked for one of my predecessors, John B. Anderson, when Medicare passed. 65 shows my gray hair, and the calculations at that time for the cost of Medicare in 1990 were $9 billion. Well, it ran $99 billion for 1990.
Quite a difference.
Anytime the government estimates something, you have to realize that they have to take as a verity the figures that they are given by the one who wants to do the estimates. And in the estimating the cost of the bills that passed yesterday, the Congressional Budget Office took as a verity the fact that there would be an increase of about $560 billion in new taxes, that there would be cuts to Medicare. Get that, you're going to expand Medicare and cut it at the same time. Cuts to Medicare of about $500 billion. Those projections seemingly never work.
Yeah, they're just not going to. Congressman, we're going to have to go ahead and cut you loose. I apologize.
Okay. That's okay.
Appreciate your
I'm
insight.
gonna get some sleep.
Yeah, I'll bet you were up a little late, weren't you?
Yeah.
All right. Always good talking with you. Congressman Don Manzullo. Take care, all right? From the Northwest Burbs and northwestern part of the state, Congressman Don Manzullo joining us on WLS.